mothers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are preparing for the upcoming Birth and Beyond online conference of 2020. And with me here is one of our speakers, Dr. Sayida Peprah. Welcome, Dr. Peprah.
Hi, thank you.
Oh, it's wonderful to have you here with us today. And we want to talk about the presentation, of course. But before we get there, tell us a little bit about yourself. You are a licensed clinical psychologist and birth doula. So tell us a little bit about your background.
Yeah, I come to this work, in a very sort of multifaceted way. I am, first of all, a mother, and I think it's, pretty significant to my interest in the topic, especially as a psychologist, because
Yeah.
sort of, your own life experience makes you very curious about other people's experience that you might be shared. I, as a mental health, clinician, specifically have worked pretty substantially with suicide. Topics and communities and prevention on protocol side, on interpersonal side. I worked initially in psychiatric hospitals when I first came into practice. And so it was always in this very emergency, immediate response. And I think working with people directly in that way, in the crisis mode when they're at their most despair, but also in an institution that isn't necessarily thinking about mothers, right? Like most
Right.
mental health facilities, and hospital systems that are sort of not really geared to consider the mother and the birthing
Yeah.
person and the lactating person. It always made me really aware at the time, especially because I was in my maternal years. I was having children at the same time that I was in graduate school, that there was a missing link. And so I became really interested in that, sort of like, what is the connection between my work and my other work, which is doula work, which not necessarily directly connected to my work as a psychologist, but my passion as a birthing person and as a mother and as someone in the community who felt really moved to help other women have experiences that they wanted to have and advocate for themselves and understand the system better. And so as a doula, then I'm working now with all these families, and I'm also a psychologist working with families in multiple capacities. And it sort of brought me to where we are now, where I do a lot of cross training between the mental health field, the birth field, and particularly looking at communities of color, particularly looking at the Black community and how we can have providers treat people
Yes.
better in all of those areas.
Absolutely, absolutely. You will be talking about understanding maternal suicide and supporting individuals at risk. Very deep topic, very important topic. I'm a midwife, so in recent years, what I've seen is it's wonderful as healthcare providers that we get more information on the topic of maternal mental health. Very, very important. Maternal suicide is going even deeper into the subject, and for my part, I want to learn so much more, because how can I support families that I work with, right? And I can tell you that many healthcare providers are feeling like, oh, is this really my scope of practice? What am I going to do? Where can I fit in? Where can I um, be a better support? So I'm really looking forward to your presentation, because you will be talking about supporting individuals, what we can do to support individuals at risk, right?
Absolutely. I think, the midwives, the nurses, the OBs, doulas, lactation consultants, all the people that are touching the mother,
Yeah.
most people feel unprepared to deal with, suicide. And I think one of the things that we do in mental health, especially in emergency mental health, is a lot of prevention. And we're always thinking, how could we have not gotten to this place? Because we're already here in the disaster and we can
Yeah.
immediately see the missing links, right? When you're at the end of a story, right? But
Right.
and so I think it's super exciting that you guys were interested in this topic, because it has sort of evaded the conversations in maternal mental health to some degree, because it's not the majority, right? It's a
Right.
smaller percentage of people. We also don't want people, to feel that suicide is what they're looking for as the main, concern, right? Because we also are concerned about people living without depression and without anxiety, and feeling prepared for parenting and for the changes that are happening to them, and feeling supported. So it's an outlier that tends to not get as much attention, just like in the general, population, as well as in birthing. And so, to get a chance to talk to this community and to have this
Right.
topic be sort of by itself centered, right? So we have general learning about maternal mental health, which we'll definitely cover a bit, to kind of get us to how do we go from postpartum depression, postpartum anxiety, what is postpartum psychosis, like where does suicide fall into that? And
Yeah.
the biggest thing is like, what do we learn from the cases that have been shared with researchers and practitioners, and the experiences in the field, when people have gotten to places where suicide is imminent for them, whether they are at high risk and it comes up, or if unfortunately in some cases people take their life during the pregnancy and postpartum stage. There have been research teams, not many, and it's a lot more research needed, but I've been fortunate enough to be able to sit on one of the research teams in California looking at cases where women died in that situation, and the wisdom to be able to share and to be able to talk about
Yeah.
what do we learn from those families is really helpful. So I'm looking forward to it a lot.
Absolutely. In your research, have you seen over the years that suicide rates have gone up?
I think one of the challenges, even in like the question, which is a really good question, is maternal suicide is not necessarily tracked in the same way that
Hmm.
other maternal deaths are. And so that's one thing that I think to make a comparison based on what we've seen is really kind of limited, because we don't have this vast amount of like consistent information that's being shared state to state the way we do with like C-section rates or
Right,
general
right,
maternal mortality that's due to a physical situation, sort of ailment, or demise. And so, in general, it sort of has been a bit consistent as far as sort of the percentages, but we do see so much opportunity for prevention in that. And so, I really just those statistics are really like more interesting to me, is like, where were there opportunities to make a difference? And it's those early stages. Like, one thing about suicidality is that it's not something that typically just arises. You wake up one morning and that is the only thing on your mind, and then there's a
right,
demise. It can be that, but it's very rare that you would have that level of sort of a psychotic event. It's very typical that there's been an opportunity for intervention, for prevention, for support, for um, some kind of wraparound services for people to detect it, and they don't have the skills. They don't know what they're looking for. Families don't know what they're looking for. And if a practitioner sees someone who's not doing well, there isn't a lot of. I mean, it takes years to gain those skills. Even as a
right,
psychologist, how do you assess for suicide? I mean, it's one of the most difficult sort of assessments that we make, is to determine, are you safe to go home, or do you need to be hospitalized, or in extended care? And so if it's hard for us as clinicians who train and
right.
practice and study, and I can't imagine, and I do know that it's very difficult for people in the fields that are not trained that way to know that this person actually needed a lot more support, more immediate, more direct hand holding, and
Right.
more support to the family than they realized. It's a huge gap in our wisdom and our knowledge in our field, working with mothers and families. And so we definitely going to get a chance to kind of look at that a bit. And
Perfect.
I will
Yeah.
say, as a psychologist, but also then as a doula and as a mother and as a community person and as a research participant, I definitely am thinking of it in all the ways that I see there's opportunity for intervention. And so
Uh-huh.
it's not just going to be for one particular, group. It's really, if you are working with mothers and birthing people and families, and this matters to you, it will be relevant to you. We're going to
Mhm.
touch all the practicals of anyone that I can ever imagine is going to touch, the mothers and the birthing people.
Absolutely. Um, what would you tell a healthcare provider, just very briefly? I know we want our listeners to come to the presentation, but how can they get started if they say this is, I need to do more, I need to, but I feel kind of overwhelmed. What do you think would be the good first step?
Well, I would say, just like anything that we know is potentially fatal or very serious or dangerous, right? If we know that that is a possibility at all, we usually have some preparation, like we have some plan just in case,
Yes.
we go to a birth. I mean, as a midwife, we're all prepared. We've checked her iron, all is well. However, if she hemorrhages, we have a plan. We've got a
Right.
protocol. We've got systems set up. We have, our Pitocin,
Yeah.
injection ready to go, right?
Yeah.
I say that because my midwife, had one ready for me, and in my home birth.
I just want
Um,
to say
but
you know a lot about midwifery right
yeah,
there.
listen, that in particular was something that everyone in my team had to be mindful of.
Yeah.
And so just like that, you want to find out in your local area, super important for it to be local, right? Because if you have a family or a mother that needs support, you need people that can respond.
Yeah.
You should have a plan for if you, for some reason, questioned whether or not somebody was safe to go home or safe to be there by themselves, or in some way that there was some concern around suicide, that you know who you could call. If you just have that, you're like a
Yeah.
thousand steps ahead, because when it happens, that person hopefully is a competent expert and connected, will be able to guide you. We don't need you to be, a suicide risk assessment specialist, but we do
Right.
need you to know who to call should you have questions, because once we get the call, we know what to do.
Right.
And unfortunately, most of the people that end up in the hospital, most of the people, of course, that end up without having had an intervention, did not have that opportunity presented to them. And so they just sort of walked from start to finish, with very little intervention. And that is, it's preventable, and we could do something. So
Yeah, I
we
like that.
will.
Thank you for sharing that, because having a plan, that's kind of, it's something doable. That's something we can really, prepare for, and seeing it as not such a topic that is kind of scary, or we don't know what to do. Just thinking of it like, okay, there is something we can prepare for. We don't have to be the experts, but we can prepare for and have our things in row, and then contact the people accordingly, and have that part of our plan there. I absolutely like that. You talked about supporting, of course, the Black community. I can imagine there's a tremendous trauma there of what kind of care they receive, in the hospital, or in the community as well. um, Talk about a little bit about diversity uplifts. I looked a little bit into that, because I saw that, of course, in your bio, and it looks so interesting. So share a little bit about that with our listeners here.
Sure. Diversity Uplifts is the nonprofit that I founded, really focused on giving practitioners and providers the opportunity to educate very specifically in serving communities of color, and
Mhm.
communities that are diverse in various ways. So minority communities, in areas, those that are, high risk, that are, typically marginalized in some way. And specifically to have, trainers and, educators that come from those communities, educating you about the community that they come from, but they're also experts from the community, right? And so bringing research from the community, and focus group wisdom from the community, and also, direct speakers from the community, is something that, in my own experience, has been really helpful. And it offers, when you have lived experience in a topic, you're able to present stories and to understand the context of research about your community that is a lot more informed than someone who oftentimes may have come from another community. The other part is really being able to support diverse communities directly, to support Black doula organizations and programs that are going to provide advocacy and specialized, care and support people, doulas, lactation
Mhm.
consultants, midwives, directly to the community. And so really finding what is the community saying that they need, and us figuring out nice strategies to help them get connected, to network. In California, we have a really robust, set of doulas, but they haven't necessarily historically been activated to serve the community, right? And
Mhm.
so,
Yeah.
how do we transition this really strong, asset and resource to birthing people, which is like the doula, to people who would otherwise not be able to afford it, who would otherwise not necessarily know about it? So, how do we do a little bit of culture shifting within communities so that people know why they would even need to have a support person and what
Right.
options exist other than the standard, births that they've experienced maybe in their family or that they've seen on television, right?
Hmm.
Um, and so really, helping the communities get more access to what they deserve to have,
Hmm.
and making sure that those providers that are serving them, we always, people, they're like, well, home birth, I had a home birth and I had a hospital birth. And so I certainly, I'm a huge advocate for home birth, when it's safe and available. Um,
Right.
but it's also not necessarily what everybody can afford
Correct.
or has options to or has access
Absolutely.
to. And
Hmm.
so for those majority of people from high risk, and not necessarily high risk for themselves, but we have learned over the past couple of years with research and statistics that have come out around implicit bias and
Yeah.
systematic, sort of racial disparity that exists in our maternal system that actually makes it so that going to a hospital to have a birth as a Black woman, may be questionably, not the safest option
Yeah.
for you depending on your situation. And so what do we do for those mothers that are going
Right.
there, who are meeting, providers who have been trained in very standard sort of dominant culture ways that don't necessarily speak to the needs? It's not necessarily in a holistic model,
Hmm.
whether it's language barriers or just communication, um, uh, processes, right? Do you spend time really getting to know your clients, or does it feel like it's okay to just sort of, hi, your name is this, and then move on? Well, how does that
Right.
feel to people in certain communities? That kind of exchange feels really hostile and feels really cold and insensitive. And I
Hmm.
think for most people, they really want to have, a sense that the provider cares for them more. But then we have all the way on the other side where we have some challenging issues, around implicit bias and racism, among providers and in the system, that we want to make sure that people have advocacy in that situation, that people have opportunities to have childbirth education within the community, right? And so there's so
Hmm.
many needs that we are listening to communities to try to support them to have.
Thank you so much for sharing that. It sounds like a wonderful organization and wonderful work you're doing there in the community, and for the care providers as well, to teach them and give them options there. Thank you so much for sitting down here and talking with me about your upcoming presentation, Understanding Maternal Suicide and Supporting Individuals at Risk, as part of our Birth and Beyond online conference here at Gold.
Thank you for having me. Looking forward to it.
And for our viewers, the presentation will be live on October 19th. And if you would like to find out more about this presentation and the other presentations of the conference, we invite you to visit goldbirthandbeyond.com. Thank you, everyone, for listening. Bye bye for now.